Hello friends, in this video I am going to tell you everything about the newly added Nbems diploma courses, especially about how the exams are like, what is the pattern of the theory exams and the practical exams. In mid-May, NB has released the final results and this was the first batch who have appeared among all those uncertainties or whether to go for such courses, from where to study, how to study, and what will be the pattern. So congratulations to my fellow colleagues who made it in the first attempt. A lot of you have asked me these questions, and so I have tried to cover all your doubts in this video. So without much delay, let's get started. How are these courses? These courses are a 2-year program and the how depends on very much from where it is being done, from which hospital you are doing. These opinions are my own, and as far as I understood by talking to a number of residents from different hospitals, especially anesthesia. So if your hospital is a multi-specialty one with good hands-on, with good or average academics and good amount of caseload, then a definite yes. You can pursue your dream branch through these courses. And if it's a small periphery center, then you should ask about the procedures and infrastructure and then decide. Small centers have advantage of good caseload and a decent hands-on, so you will have equivalent exposure just as government overloaded hospitals, but academics and infrastructure is questionable. Now about the internal exams. Throughout the 2-year course, you will be having 2 internal exams. One is FAT exam and another is internal appraisal exam. So if you study for these exams a little bit, it's gonna help you in your main exam preparation. Both of these exams are kept for practice only and not for any marks benefit. But please remember, your attendance is mandatory. So FAT and internal appraisal both will have theory on one day, divided in 2 sessions. Ours was from 9 to 11, 9 to 12 first session, 2 to 5 second session. For FAT, you will get it center mostly in your city and internal appraisal will occur in your hospital only. But practical center can be given anywhere in the state from the best of my knowledge. Now about the main exam. Three center choices will be given among the list you have to choose during filling of the application form. Theory will be of total 300 marks and it will happen in 3 days session. The syllabus will be divided in paper 1, paper 2, paper 3, 100 marks each, and each will be of 3 hours. The question paper will be displayed on the computer with a clock which will show time in minutes. You will have to manage time accordingly. We got time from 2 to 5 p.m. for each session. Now let's move on to the practicals. Practicals will also be of 300 marks. No center choice will be given and mostly center will be outside your state from which you are doing residency. It will be a single day exam starting from morning around 8:30 a.m. and you will get free by late noon or evening. There will be no OSCE in diploma exams unlike DNB 3-year courses. The gap between theory and practical will be a minimum of 2 months as in DNB exam, although we got a 3-month gap in between. The total number of examiners will be 4. There will be 3 externals and 1 internal of the same institute or hospital. There will be difference in pattern among different branches and I am here telling you about my branch anesthesia, in which 4 major cases of 50 marks each were given along with 5 stations of 20 marks each. This was the checklist given to the examiners showing the different stations. In the first station they kept ABG, PFT, nerve blocks, IV fluids and other investigation or techniques. Second station was about drugs, equipments, machine. Third about the difficult airway algorithm or ACLS. Fourth one about the research, recent advances and subspecialty. And fifth one was about the communication skill. So this was all about the exam pattern. If you find this video useful, please give a thumbs up and hit the subscribe button. In my upcoming videos, I will try to cover from where to study for these exams and what are the multiple options or applications to boost your performance. Thank you for watching.